And good evening and welcome to the April Health and Education Committee meeting. And everyone present tonight as usual. The committee, good evening to you. I need a motion to approve Becky's wonderful minutes that she sent out to everyone.
So moved.
So moved, Commissioner Allen. Second, Commissioner Soriano. Any comments, suggestions? There are none. All in favor, please say aye. Aye. And opposed? And nobody ever opposes the minutes. That's quite a compliment to you, actually, isn't it? You oppose everything else, but not the minutes.
Remind me next month. I'll try and do it.
Community care report. It's on your, what is this thing called? An iPad? It's on that thing right there. I'm scared to touch it. I've got the school amendments up, so I've got paper copies of everything else, and so do you, I guess. But Ms. Cook, you have any comment on community care? You're on their board.
We're doing well.
These positive reports continue on community care, and it's well run. I think we all know that. Mayor, any news at all in that regard?
No, I mean, it's still a continuing good operation, and their receivables collections are good, and their cash position is excellent. And they got a little bit of construction going on that they'll probably finish up with some little bit of addition there where they're connecting a couple of the wings together this summer. So
We have a compliance officer for community care now. So if anybody has complaints, they go to the compliance officer.
in the last 2 months, he's had nothing to report to the board.
We don't know what he's doing, but he didn't.
That could be good, that could be bad.
That's good.
I have to say, I think it's fair to say that Mr. King's not here to receive our compliments, but I think that's a very well-run operation out there, and that's terrific.
Move to approve
Thank you,
the
Commissioner
report.
Phillips. Appreciate it. A second.
Second.
Ms. Allen, thank you so much. Any comments? All in favor, please say aye.
Aye.
And opposed, and there is none. Okay, Health Department, Ms. Garrett is with us. And I think she has an amendment. I did ask committee for, and an email was sent out, now you probably got a copy of it, for community care, Ms. Garrett and Ms. Jolly to try, if they could, to skip the May meeting. We wanted to concentrate on school board business that night only, but obviously if they have an emergency, something that must be handled, Ms. Nolan could handle it, the mayor, or one of us for that matter. But we were going to try to just limit that to school board. And Ms. Garrett, I think you have something, I know you have some other things, but you have something that really was, you were bringing next month, but you're bringing tonight, right?
Yes.
And welcome, Ms. Garrett.
Thank you. Good evening. This was just recently. I didn't get it electronically, so you have the paper copy of a salary supplement document that we submit once a year, and so I need to get your approval to submit that on further.
I'm going to give you a second to look that over. You've had it for a little while. If I recall, this is normal conduct of business here, isn't it?
This is
Yes.
state money. This is state.
Yes. Yeah.
And the same thing we do every year. I'll make the
Yes.
motion to approve as presented.
Thank you,
Second.
Commissioner Jordan. A second from Ms. Cook. All in favor, if there's no discussion, please say aye.
Aye.
And opposed, none. Ms. Garrett, you have, that's your only thing that requires a vote, I believe, right?
Yes. Oh, well,
You have
my
a report.
report.
I'm sorry.
Yes, sir.
Go ahead.
My report this month is, I have that electronically for you guys under the health department listing. And it looks like we're still in our primary care services having lower census numbers in the patient encounters that are coming through. And a few of our communicable disease programs like STD, those numbers are lower. I feel like some of those primary prevention projects that we're doing in the community to get education, make easier access to medicines, and those kinds of things have resulted in those STD numbers being a little bit lower. Checked with counterparts around, and they're not seeing that same success in that program, so that's a good sign. that those numbers are going down, like tuberculosis numbers showing up. That's because we're really reaching out to communities and high-risk areas and doing testing and getting them before they become active, and you do the treatment for them before they become active and could spread disease. So those are numbers we want to see go up. And normally you would think, oh, we don't want to see TB numbers go up, but that explains that number there. But the primary care, the men and women coming in, it seems like those numbers continue to be down a little bit. I think the economy is a little bit better now. And there's been some changes in insurance policies and people being able to get on certain insurances and things. We've had quite a few clients recently say, well, I'm going to be able to be eligible for insurance now. Can I get a copy of my record to move on to a primary care doctor? So that kind of explains where we are on my report. Any questions? I'll be willing to answer.
Any luck on the dentist at all?
Well,
Even after our extensive,
so funny that
publicity
you,
last week?
yeah. Well, we interviewed two. Both were not interested, and then the state has recently figured out a way to get some more salary, and that will help hugely. Mm-hmm. And so the rumor is already out. And today I got an email from someone wanting to interview that there may be some more increase. So it's all in the works. I'm trying to get it formal so that we can interview. So good news coming, I hope. I get to report that we'll have us a dentist, I hope.
Looking at your report, I mean,
Yes, sir.
Murfreesboro to Smyrna, the numbers are totally different
Yes.
on a lot of the different things. Are the demographics that much different in Smyrna, or what do you know?
You mean quantity-wise,
Well,
or
I mean,
what?
just
Give me
some
an
numbers
example.
like family planning is significantly down in Murfreesboro. If I'm looking at year to date, and in Smyrna it's up. I mean,
Yeah.
or on some of them, and the STDs, you mentioned that it's from 760 to 530 in Murfreesboro, but it went from 239 to 275 in Smyrna. And
yeah.
different ones, age prevention
And that-
is down, yet it's
Right.
up, and
Right.
there's just a lot of variation between Murfreesboro and Smyrna.
Yeah,
on
and we
year-to-date
do see
numbers.
different things. There's a couple of things. First, on your family planning question that you asked, we have been sharing our state family planning provider with another county who has no family planning. We have tried to replace those appointments by having other providers see them, but it is one less staff a couple of days a week.
This is staffing oriented. On
That
where
one
the
is,
personnel
yeah.
might happen to be in
Exactly, one
location
side or the
or
other.
whatever.
But some of the things like STD and AIDS prevention, it alerts us that maybe we need to focus on those areas. We've been maybe focusing on MTSU and those kinds of things with those programs, and kind of show that we need to focus more in Smyrna on that, or that end. So yeah, that's why we kind of do this report and look and see where are the differences, and there's a ton of other data that we get and kind of look at who came through each month. What age were they, and what race were they, and where do they live, and
10 or
that
15
kind of-
miles between the two clinics, so
It-
you would think they would track somewhat
yeah,
the same, but
but definitely we see a difference in and we have always seen more WIC participant need also in our Smyrna end as well. So, and you can see those numbers too.
Smyrna difference could be, we've just been fully open with the expansion down there just a little over a year or so, haven't we?
Yeah, let's see, when did we get into the
Last-
new
last spring. Was it
last spring, yeah.
some people may still be getting
Yeah.
used to having the facility there and the options there and things like that.
Yeah, that's true too. And we have 8 staff there, so it's a very small staff, but they do amazing numbers for that amount of staff. We share quite a few with Murfreesboro as well. They'll do both. Health educator covers both. The diabetes team covers both sites.
Any other questions about Ms. Garrett's report? If not, need a motion to approve.
So
Mr. Soriano, thank you. A second?
Second.
Second, Mr. Turner, thank you both so much.
And just one fun thing about our mayor's walk.
Wait a minute.
Oh, y'all got to vote. Sorry.
Yeah.
I forgot that part.
I'm the one that's supposed to forget that, not you.
I had
If there are
it
no
in
further
mind.
comments or discussion from Ms. Garrett, all in favor, please say aye.
Aye.
And opposed, there is none, and, okay, we're in good shape there. Mayor's Wall, I know,
Yeah. Sorry, I jumped ahead.
that's all right. That's usually myself that does that. We had, Mayor Burgess was there last time.
Yes.
And Mrs. Mayor was walking.
Yes.
I got to walk twice. Mr. Soriano set the pace for us.
Yes, yes.
With the Oakland and other places too. But
Yeah.
how's he? I know you got 2 more, so go ahead and promote.
Yes, we have 2 more this Saturday, 8 o'clock at Rogers Park and 11 o'clock at Patterson Park. So if any of you are free and you want to come out, we'd enjoy having you. And basically the whole idea behind this, y'all have heard me talk about it before, is just to highlight all the wonderful, free, beautiful areas that we have for people to walk and enjoy. And so we've gone to Oakland's and done some walking, and McKnight Park and did some walking, and we've had quite a good turnout, about 150 at Oakland's and I'd say several hundred as we go along. So great turnout, people coming out, meeting the mayor, meeting the commissioners, and getting to see the great parks. And I really appreciate y'all's leadership role and being out there and showing them to walk the talk and, actually leading us in the walks. It's been great and very enjoyable. I've met all kinds of people throughout the community that have come out to support it. Just 1 mile walks. They're easy. We're not, so no matter what your fitness level, you can come out and give it a try. So.
Do we have more? Are you going to do any more this year?
This is Team A. So we're doing primary prevention against obesity in the health department. 5% of all my staff's time is focused on trying to prevent problems in the primary stage. And the one that this group chose was obesity. And so the next group that comes along, they will also focus on obesity, and they're going to expand it. So we hope to do these in Smyrna, Laverne, some more places in Murfreesboro with some schools. And there's even been suggestions of like maybe a church would host one or a civic group would host one, and we would, bring all the toolkit to make it happen, and then they would be the host of it. So just to kind of keep this going and showing people that it's just amazing how many acres of parks we have that are available for people to go out and enjoy and take advantage of.
Okay. Any questions for Ms. Garrett about the mayor's walk?
Just one, if you could
Yes, sir.
highlight, especially for folks that may be watching, obesity prevention is something that's easily said.
Right.
What does it really mean? What
That's
are
a
you
great
doing?
question. That's a great question. So statistics show us that in Rutherford County, 60% of our residents, so 60% of them are overweight or obese. And then that shows us that there's also 37% of our community that report completely inactive, not doing any kind of activity at all. So those numbers are staggering and show us that we also have very high numbers of diabetes. We have high mortality and morbidity numbers, which is early death and sickness. And we've seen the correlation between being overweight and inactive causing those diabetes and chronic diseases and early death. So what our goal with this primary prevention is to try to introduce people to places where they can go and remove barriers that's free. You can go and enjoy the park and walk and get some activity, hopefully then increasing your non-active life and decreasing weight. We also have some other partners with it, with doing cooking classes and eating healthy and those kinds of things where it ties all together. But that's a great question, because that's exactly what we're trying to focus on is teaching people why is it important to get active and why is it important to lower our weight. And it's to help those statistics, which will equally increase our health and make us a healthier community.
Just another example of who do you refer them to as far as cooking classes or
Well, we do
eating
some.
habits?
We do some in both Smyrna and Murfreesboro. We have cooking classes and something we call lifestyle balance class, which is basically teaching us how to balance our life, to cut back stress, eat healthier, get active. And it's like a 6-week course. They can check all that through the health department. But we also partner with the Ag Extension Center, with the farmers market, to make sure there's chances for people to have available fresh vegetables. In Rutherford County, we're one of the few counties in the state that accept WIC vouchers and food stamps at our farmers market. So we've tried to make it as open as possible for people to have good choices for healthy fruits and vegetables that are locally grown right here by our own farmers. So that's one partner that we work with on expanding that as well. And we've done those classes in senior centers, and we've done those in early ed classes. So we kind of try to hit all the.
Put a plug in for Farmers Market. When does that start?
I will get the dates for sure, because I was talking to Ms. Cook about that before we started. I believe that we usually start towards the one in Smyrna. Will start in probably May, early June. Another one on the square starts in June, and the one out at the Ag Extension Center, I can't remember off the top of my head, but I will tell y'all next week.
They're usually on Fridays, correct?
Yes. Let's see. The one in Smyrna is on Wednesdays, and it is at the Smyrna Health Department in their parking lot. And
The one here is on Saturday.
One
isn't
at
it?
the Ag Center is Tuesday.
Tuesday, Fridays.
Tuesdays and
Tuesday and
Friday.
Friday.
On the square is on
Saturdays.
morning.
Yeah, on Saturday morning. Yeah, thank you for helping me remember. I couldn't remember off the top of my head, but yes, I will bring that because that's good information to share.
Thank you.
Mm-hmm.
Some wonderful locally grown stuff, and the prices are
Great.
nice.
Yes, thank you guys.
Anything else, Ms.
Appreciate it.
Garrett? Thank you for your leadership on the mayor's walks. Appreciate it, and I look forward to, the Ag Center would be a good place to walk, for that matter. And,
Yeah.
And Laverne or Smyrna High School tracks at the schools would be great places
Yes,
to walk.
I've been working with Coordinated School Health, and that's the nurses in both of the schools trying to figure out a way where we can do some walks, like bring the kids out and do some walks. And we do some activities with Targeted School, but we just got to multiply ourselves about 100 times to get to all the schools.
Thank you, Ms. Garrett.
Thank you.
All right, Ms. Jolly? Special Projects Report. Ms. Jolly, welcome.
Speaking of the picture of health,
Yes.
On page 1, Stewart's Creek High School is 86% complete with 78.91% spent. And then we're still at the same place with Eagleville, 94.58% spent.
Eagleville is all done.
I don't think it's completely done. I think there's
It's
some minor-
100% complete, but there'll be bills
Construction-
coming
The
in.
construction's complete, but not the.
Yeah, that's construction.
Last time I was out there, I think they were doing some touch-up painting and whatnot, so they may lack a little, I don't know, but I think it's pretty much complete. We're gonna need that money. But I think the other report is exactly what she corrected it to be the last month when we were together, right? So it's the same thing at Stewart's Creek, so, I don't know, we can ask, I guess, but, I did drive through there 3 weeks ago and looked, I didn't get out, but I just looked at the stadium from the stadium one end to the other, and, it looked terrific. Now, I understand the school board has taken a tour within the last 10 days or so, and have gone through the thing, and I did talk with school board member Tim Tackett, and he was mightily impressed, so all that sounds good.
We've had some beautiful schools.
Well, that one be open and ready to go. I'm sure that the new principal, Mr. Darrell's ready to, I don't know if he's gone out there yet or not. Has he moved out there?
No, they're still the same.
Okay, he'll be out there fairly soon, I can assure you of that. And okay, any questions from Ms. Jolly? If not, need a motion to approve her report. Ms. Cook, thank you. A second?
Second.
And Commissioner Soriano, and no questions, comments. All in favor, please say aye.
Aye.
And opposed, there's none. Thank you, Ms. Jolly.
Thanks, Teresa.
I'm looking forward to, no, really, I'm not looking forward to one of your 40-page reports, Ms. Jolly.
Oh, I'm
I'm not either. I lied already. I'm not looking forward to that at all.
But you're looking forward to mine.
Yeah, report, there you go.
Mr. Savick, good evening, sir.
Tree in his
You
hand.
pulled yourself away from school board business, and they moved you up on the agenda then, didn't they?
Actually, because of the visitors, they had moved me up, but I wouldn't be, well, I might be on my way now if I had,
Well, you just walked out on them,
yes.
essentially.
Well, we'd like
Mr.
for you to
Savick
come
has
see
some
us.
amendments, and we've had these for some time.
Get it right in the middle, Jeff.
I'm I'm sorry, sir.
Okay.
Mr. Sandy.
That Jeff.
There you go.
All right.
He needs to be careful when he says hit it.
In that case, that's exactly correct. Don't tell Jeff to hit it, we won't have any equipment at all. Sandy, please.
Start with the amendments?
Yes, sir, that'd be fine, and since he has 6, let's just do them one at a time, and that will relieve any confusion, if that's all right, committee. Sandy, go ahead.
All right.
We need another copy down here for
She needs,
I'll get it when you're finished.
Commissioner Shelton.
Okay.
I'll get it.
Yes.
he doesn't want you to have it.
Yeah, she's welcome to it. The first budget amendment covers certified staff. It reallocates $26,113 in teacher pay and benefits. $24,678 of that is already budgeted teacher pay, and $1,435 related benefits. And just in order to cover different changes we've had, primarily driven by degree and experience. And our recommended motion is to amend $26,113, $24,678 of which is already budgeted teacher pay, and the $1,435 in related benefits in order to cover staff changes as presented.
Thank you, Mr. Sandy. Questions, committee? I think you'll find that all 6 of these are, we're going to be in good shape, I believe. But I think it's best we take them one at a time. I need a motion to approve number 1, please.
Motion approved.
Thank you, Commissioner Turner. A second?
Second.
Second, Ms. Allen. Thank you. All in favor, if there are no further questions or comments, please say aye.
Call the roll.
Oh, call the roll. That's right, money. That's right. That's right. Ms. Garrett, we need you. She's gone. You need to call the roll.
Commissioner Allen?
Aye.
Commissioner Cook?
Yes.
Commissioner Will Jordan?
Yes.
Commissioner Phillips?
Aye.
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes. Number 2, please, Mrs.
Number
Sandy.
2 is a similar amendment for classified staff. We are reallocating $75,606 in already budgeted classified staff pay and benefits, $67,062 in pay, and $8,544 in related benefits in order to cover staff changes that have occurred since the 2012-13 budget was approved. And the one piece in that is a little weird. Our attendance system has been acquired by Pearson. We are probably going to need additional training. We are going to have to go to another system. And I went ahead and moved some additional hours in to cover the attendance function.
When will that happen? This summer?
It looks like it won't happen this summer because I'd be moving a lot more in if it were this summer. But we had to straighten out and reconcile the EIS system. The state, because of an audit finding they got at the Department of Ed, this year did start requiring everyone to have the EIS, Educational Information System, I think. All of their attendance reported through that, which is a statewide system with its own set of challenges. But that was the only weirdness in that. And our recommended motion is to amend $75,606 in already budgeted classified staff pay and benefits in order to cover staff changes as presented. And this is out of about a $19 million piece of the budget. It's a minor amendment.
We've been fighting attendance systems as long as I've been a commissioner, it seems.
They become technologically obsolete or the state changes on us. Which, the first one I dealt with became technologically obsolete.
We're totally at the mercy of the state.
Yes, sir. We are getting some money toward the software cost of it from the state, though, which is a plus.
Motion to approve.
Thank you, Commissioner Jordan.
Second.
Second, Ms. Cook, thank you. Any other further comments? If not, call the roll, please, Ms. Shelton.
Commissioner Allen?
Aye.
Commissioner Cook?
Aye.
Commissioner Will Jordan?
Yes.
Commissioner Phillips?
Aye.
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes. Number 3, PEP.
Number 3, when there is an increase in the state's insurance rate for teachers, we get a flow-through piece, a mid-year adjustment to our BEP money. Like us, their plan year goes January through December. Doesn't match the fiscal year. So this amendment budgets the $270,000 in additional state BEP funds the system will receive for this mid-year insurance increase. I put it in lines where I think it may be needed, and I did go ahead and adjust the other miscellaneous life insurance, the long-term disability, $10 adjustments, minor adjustments in those, just doing one insurance amendment. The recommended motion is to amend $270,000 in additional state BEP funds the system will receive for mid-year insurance, and to increase the insurance lines and to adjust other miscellaneous insurance lines as presented.
Will that 270 cover the increases?
We had already budgeted the increase on our side, and they give a little information. So I had budgeted some mid-year insurance money, and this took us up to the full amount we should receive. But we are in good shape in this year's budget in medical insurance, which is, we haven't had that, I haven't been able to say that in a couple of years, so.
Well, because I had a message today from a constituent. I've not had a chance to call her back yet, but there were some concerns about some changes to the insurance
that
were going to
is
be affected
in the next budget year, and the next is effective January 1, 2014.
Okay.
That's what's being
After
accepted.
we go through this, I may need you to explain that to me then.
Okay, I'd be happy to.
Any further questions? If not, need a motion to approve.
Motion to approve.
Mr. Allen, thank you.
Second.
A second, Commissioner Soriano. Call the roll, please.
Commissioner Allen?
Aye.
Commissioner Cook?
Aye.
Commissioner Will Jordan?
Yes.
Commissioner Phillips?
Aye.
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes. Page 4. Mr.
The
Sim.
fourth amendment is for the special education high-cost students. This amendment budgets $241,326 in state flow-through funds for high-cost special ed students that the system received. This is driven by last year's numbers and services. These funds must be budgeted for current year non-administrative special ed expenditures, and the amendment increases expenditures in line items where we think it will be needed or could be needed.
Can you give me an example of a non-administrative special ed expense?
I can't pay Shirley Bell anymore out of that money.
Okay.
But as far as anyone who is providing direct services to students, a psychologist, a special ed psychologist, a speech and language teacher, a sign language interpreter, any of those, their benefits, contracted services for those students, anything like that.
Okay.
But it has to go in the current year budget.
You're gonna spend that 241 this year?
I have to budget it this year.
Okay.
We will spend
Thank you.
definitely some of it this year, but we do have to budget it this year.
Thank you.
Yeah, and that is a guess on what our number, this number is accurate, but when we prepare the budget, we really don't know. I try to budget low on that figure, and then just bring in an amendment every year. The recommended motion is to amend $241,326 in state flow-through funds for high-cost special ed students to the special education budget line items as presented.
Motion to approve.
Second.
Commissioner Turner, motion to approve, and Commissioner Allen, the second. Any comments, questions? If none, call the roll, please.
Commissioner Allen?
Aye.
Commissioner Cook?
Yes.
Commissioner Will Jordan?
Yes.
Commissioner Phillips?
Aye.
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes. Number 5, miscellaneous
Okay.
revenues.
This amendment budgets $36,000 in rental income for the custodians' apartments in our high schools, which offsets the flow-through expenditure in custodian pay and benefits we had to record for the audit this past year. The balance of the amendment deals with contributions. It does take $21,175 from the fund balance because of a 2011-12 donation from the Jennings Jones Foundation that was given with the designation that it be used for staff development for the gifted program. So the other is another $59,606 in donations to the different line items as specified by the donors. The recommended motion is to amend $21,775 from fund balance to account 72-220-524, special education staff development, $36,000 in rental income, which offsets the flow through pay and benefits for those resident custodians, and $59,606 in donations with the related expenditures as presented.
So moved.
Second.
Commissioner Allen, thank you. Commissioner Turner for the second. Please call the roll if there's no comments.
How many of those?
Excuse me?
How many of those facilities do we have?
All of the comprehensive high schools.
Oh, cool.
Anything else? Michelle?
Commissioner Allen?
Aye.
Commissioner Cook?
Aye.
Commissioner Will Jordan?
Yes.
Commissioner Phillips?
Aye.
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes. Mr. Sandy?
All right, my sixth amendment is career ladder and extended contract. These are state flow-through monies, and the amendment reduces state career ladder revenues by $184,118 and reduces the expenditures by $158,000 in pay and $26,118 in related benefits. And as teachers who qualified for the career ladder program retire, this number's been dropping. It also reallocates $2,000 in state extended contract expenditures and the related $331 in benefits in order to cover a staff reassignment due to a retirement last year. The recommended motion is to reduce state career ladder revenues by $184,118 and to reduce the related career ladder expenditures by $184,118 and to move $2,133 in extended contract expenditures from $71,100 regular education to $72,220 special education program as presented.
So moved.
Second.
Commissioner Allen and Commissioner Jordan? I did notice that on your next year's budget, career ladder is down to almost nothing.
Right, and it used to be about every other year I'd drop my budgeted figure. I budget the revenue to equal the expenditures, but yeah, I'm pretty much doing it every year now.
Ms. Shelton, call the roll if there's no other comment.
Commissioner Allen?
Aye.
Commissioner Cook?
Aye.
Commissioner Will Jordan?
Yes.
Commissioner Phillips?
Aye.
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes, centralized cafeteria.
All right.
Sandy?
And hopefully this is the only amendment for this year, but in this amendment, I'm reducing revenues by a net of $239,711, decreasing expenditures by a net of $38,043, and reducing the reserves restricted for school nutrition by $201,668. $164,747 of this decrease in reserves is to cover two equipment purchases that we couldn't wait until next fiscal year, a compressor and a hood system. And any questions you have on this, I'll be glad to go into more detail. The recommended motion is to amend the 2012-13 centralized cafeteria budget by reducing revenues by a net of $239,711, decreasing expenditures by a net of $38,043, and reducing the reserves restricted for school nutrition by $201,668 as presented.
Which schools received that equipment?
Smyrna Middle, I think, gets the hood system, and I don't remember who gets the compressor.
And when you said that you have to reduce the revenues, does that mean we didn't have as many people buy lunch?
When we prepare this budget, we still don't have our final revenues set by the feds.
Gotcha.
So it's just, I was able to I was hoping I could offset and have a zero balance, but we're leery of doing that. Yeah. And this is the fund where we'll go over this next month of the budget, but our metric here, we are to have no more than 3 months worth of operating expenditures in our reserves. So that has been the advantage of centralizing. We have been able to take money from the reserves. We budget some from the reserves each year, and then with something like this coming up. And some of these items are things we used to cover either from if the school did not have enough money in its cafeteria fund, we had to cover from the GPS budget. That was unusual, but it wasn't unusual to cover them from the building program. So these are things we have been able to shift into the cafeteria program since that point.
Further questions? Need a motion to approve?
So move.
Mr. Soriano, thank you. A second?
Second.
Commissioner Cook, thank you. Ms. Shelton, we'll call the roll, please.
Commissioner Allen?
Aye.
Commissioner Cook?
Aye.
Commissioner Will Jordan?
Yes.
Commissioner Phillips?
Aye.
Commissioner Sereno?
Yes.
Commissioner Turner?
Yes.
Commissioner Jordan?
Yes. Mr. Sandy, you got 49 yes votes.
Wow.
You paid extra.
Well,
didn't you get?
do you want
Let's keep going.
I have a
Let's
question
go
for
for
you,
56.
Before you hand anything
Yes, sir.
out, everything, I know you have some other things you want to say, and I see papers. Everything else that you've got going to apply to the budget at the
Yes,
May
sir.
21st meeting?
Yes, sir.
Okay,
Mhm.
well, let me start you off.
All right.
Committee, as you're well aware, on May 21, we'll meet at the school board offices. And hopefully, maybe the only thing we will do that night, but it's a big task, will be to look at the school board requested budget for next year. I ask your help, please. It's a big room. Our budget committee is present. The school board is present. I don't know that we've ever had anybody, maybe one person that was absent 1 year or something. It's a lot of people for me to watch. I'd like your help, but I do not want to leave that room that night without everybody having their say, whether they're in agreement or not, or on this committee or not. But it is our meeting, and we'll be the only ones voting, but we will not be the only ones asking questions. I will, of course, entertain your questions, comments, concerns, obviously, first, since it is our meeting. But the school board can have input if they so choose. The director, Mr. Sandvik, Mr. Clardy, I'm sure will be there. Ms. Nolan, our mayor, and others perhaps. And of course, our budget committee also, who will get whatever we do, they will eventually end up with it.
It's at 5 o'clock.
It's at 5:30. Right, 5:30. I want to be sure that all views are expressed, certainly. We will have, I'm really saying this for the public as much as for anything else, but we can approve their budget. We can send them less dollars than they're requesting. We can vote that evening to hold another meeting if we can't come to an agreement, a consensus, and no vote is taken. We've got some options there, and I just ask your help in helping me, I guess, to chair the meeting. Mr. Sandvik has some materials for you. I can see them from here, and some comments, perhaps on that night's meeting before he starts. Do you have any questions from me, or this is your all's third meeting at least in this term, so we're all pretty, I think, comfortable with what we do. But if there's some improvement or something, if you want to see me privately, something you'd like to see done differently, please let me know. Mr. Sandvik, please.
All right.
That meeting on the 21st
Yes, sir.
will take place of the scheduled meeting on the 28th, and we will not meet on the 28th.
That is correct, sir. That is exactly right.
Okay. Well, as y'all may have seen in the paper, our preliminary number is $300,654,000, and this is still a preliminary number. We are still, one of the biggest tasks we have at the central office level, and working with the high school principals with opening Stewart's Creek High, is reassigning positions. And one of the pieces that makes that more challenging is because of the grandfathering of current sophomores and juniors, next year's juniors and seniors. It just makes that much more challenging, and we're trying to get commitments of where the kids will be. And when we open that high school, your core classes are easier to reassign. It's when you get into all of the elective classes that it becomes more challenging. You still will probably have, if you have 2 Spanish teachers, you're probably still going to have enough students that you're going to still have to keep 2 Spanish teachers. And when you get into the vocational programs and all that, but those are the things that the instructional staff, working with HR and Mr. Odom and the principals, are still refining. We have a 1.5% state raise built in, which kind of in line with what the county is talking at this point. We have that raise for everyone across the board. Medical insurance is the big shocker for all of us in this year's budget. What I have built into this version is one of the versions that will be presented at Thursday's meeting. It is a 24.6% overall increase, and the employer paying 87% for anyone who is employer and dependent. If it's an employee with child, employee with spouse, employee with spouse and children, that is dropping from 88% in this year's budget to 87%, which is something the insurance department discussed last year. Right now, I have a $6.25 million increase in medical insurance with that proposal in place in the budget as we normally let it stand. So that's the biggest shock. We do have $2.2 million for technology, which is, and I'll find out more next week, hopefully, which is one-time money to help prepare us for Common Core and the standardized testing that we will be doing online. So we have $2.2 million in expenditures. You'll see that in the equipment lines, but we have it is our understanding, a one-time, totally funded by the state, $2.2 million. So that is also part of that increase. Our revenue numbers are looking like, you know, a very healthy improvement over this year. We are, in the preliminary estimate that we've gotten of the BEP, picking up a little over $10 million in the BEP. Our growth, you know, this budget is not, you know, we're not starting from that same point as we started this year, because we have had our growth. There is some lag in the growth. Our first growth number was substantially better than I thought, or than I budgeted. I was trying to be conservative. Lisa and I both try to do that on the revenue side. Our attendance percentage, like 7th month to 7th month, et cetera, has been holding or slow. You know, it's maybe creep up 0.1% here or there. Our growth number, our growth money should hold for this year. So we have some bright spots there. The revenue that Lisa and Elaine are putting together right now is at $286,031,000. Our amended budget so far is $270,852,000. So we're seeing a substantial increase on the revenue side, which was quite nice to see. And right now, I think we have 9 buses to accommodate Stewart's Creek High and the changes in routes we'll have. But the big point is we're still finalizing those secondary staffing assignments. And
when you make these kinds of changes on the staffing, is the result sometimes that you might lose an elective at a school?
Oh, absolutely. Mm-hmm. Yeah, and we have to look at the enrollments and weigh the cost. You know, ideally that would not happen, but we would look at, and I'll back up on the vocational. We have to keep these vocational tracks in place. Mm-hmm. So that's one of the things that was changed some years back. So if you've got a student in a particular track, we have to keep enough at his or her current school so that he or she can finish that track. Okay. So, yeah.
And then when you get the insurance quotes, do they ever go over with you the reason for the increase? I mean, is it simply just the change in what's happening in the industry? Is it the change in additional dependents,
A little
coverage,
bit of
our experience
everything.
rating?
You name it.
Obamacare, different things.
Yeah, I have in the last 3 to 4 weeks spent hours with Miss Stinson, Miss Nolan. We've brought in our consultants. You know, we have looked at all sorts of things. There are several proposals that will be examined at Thursday's meeting.
2 work sessions already that the insurance committee
Right.
has.
Mhm.
And it's still a
Oh, yeah.
scary
Yeah,
place.
it is.
You know,
Mhm.
it's unbelievable.
Yeah. Yeah.
You mentioned the preliminary budget numbers for the school board are right at $300 million.
Mhm.
I happened to be going through a cabinet at my mother's house
Mhm.
last week
Mhm.
looking for something on a newspaper from 1984, which to me was just the other day. The school board presented their budget of $24 million in 1984, and the commission vowed not to fund it. It was too much money. And that was
Yeah.
$24 million.
Yeah. Yeah, I have a cabinet that goes back into the early 70s, and it's amazing when you look.
Sandy, you're going to be giving out some
Yes,
materials,
sir.
of course, and I would assume we've got a month. There's probably going to be some
Yes,
changes
sir.
in these before we get
I
there.
fully anticipate that.
Okay. I just,
Yeah.
all of us, all 7 of us absolutely need to be very cognizant of
And we could only
what he's
borrow
about to
10
give us.
million.
I'll try to do my part, and I'm sure you all will as well. We have got some, well, you used the term shocking with the insurance.
Yes. Mhm.
It's shocking at the Jordan household too, and I'm not on this plan, but the plan I am on is shocking enough,
Right.
so
Oh, yes.
it's not good for any of us. But at any rate, you give out whatever you need to give out, and
Yeah.
if there are no other questions for Mr. Sandvik, we'll give him a second to give those out.
Yeah, I will be very interested when I see the state rates, because I've heard that they are not going to be fun either. So,
Well, the school board is meeting this evening, and that one of on their agenda is the insurance discussion again, isn't it? I think they have one just about every time they meet now.
I should have passed those the other way.
No, we get confused. Keep us in there.
1990, when I was elected, I remember I was on the budget. Was allowed to borrow $10 million.
Our total budget that year, Will, was around 70 million, if I remember right. Total budget, that included schools. That was only yesterday, right, Carol?
That's right.
Yeah, I thought the mayor might. I said around 9, but I've got more here if they don't make it.
Trying to take 2 of everything. Yeah. Okay.
Jimmy Joe.
Sandy, anything else, sir?
If y'all don't have any questions, you want to talk about insurance after
It
this?
is.
Gladly.
So we keep studying this until next month.
Yes, and we will of course be, whatever copy, whatever version we're working for and anticipate working with at the 521 meeting, we will mail to all of y'all.
Okay, excellent.
Actually, Jeff, can you go ahead and just give us all the highlights about the phone call that I received today?
I can give
talk
the
about-
best answer I
yeah,
can.
Because I'm just thinking, if I got this phone call,
Sure.
everybody else is
Right.
gonna get the phone call
Mhm.
too. I believe she was retirement age.
Has she retired?
I'm not sure. I'd have to listen to the
Okay.
message again, but I
The
think
phone
maybe.
call I got from somebody in your district was probably the same person,
Okay.
was retiree,
Yes.
under 65.
Retiree under
Yes,
65.
that's it,
That's
yes.
the bad spot.
Yes.
That's the worst spot.
That's
Yeah.
correct.
So
That's the
Yeah.
worst place to be.
Yeah.
So
Yeah.
explain to me what's going on with them.
That is the piece that we have, one of the big pieces we have spent hours on, meeting with the insurance side. Last year, and Lisa and I both learned a few things in some of these meetings. The trend that our consultants and we look at tends to be more about 23 months. We have the problem, we are setting rates April, May, definitely by June, that will start the next January. So we have a lag time, and they look at a 23-month trend. Our 23-month trend last year for pre-65 retirees was running at 120%. We made the decision as insurance committee, it was the recommendation, Ms. Stinson and all that, we will try to view this as a one-year aberration. And there was a 20% increase for that group.
Compared to the other groups, would be how much?
Well, the other groups wound up 20 also. But we look at, and that's the point that the school board is discussing right now. We look at our active employees. We have a pre-65 retiree group and a post-65 retiree group. There is a governmental accounting standard number 45, which we adopted with great pain. Several of y'all remember that. And we didn't have a choice on it. And we have to account in our consolidated financials for what we pay toward our retirees' medical insurance and an imputed value or a projected value of our 22-year-old employee, our 55-year-old employee, all of our employees, what part of that retiree benefit are they earning this year? And very involved getting with the actuaries and all that. So last year we went with a 20% increase, hoping it was an aberration. In the 3 months trend that we have looked at, because we see big swings in this group. The first one, if I'm rounding, I believe was 130%. When we looked at the next month, it had dropped to 90. When we looked at the third month, it was back up to 160. We did not feel we can anymore say this is a one-year aberration. And that we looked at everything we could do to try to justify coming up with the smallest increase we could, and that is why one of the proposals is a 50% increase. And it would have been very easy to come up with a higher number.
There are only around 160 participants in that
166 was
Yeah.
the number we were working with, which is a small group, and that's the concern that is being expressed at the school board tonight.
If you go to YouTube and look at yesterday's school
Right.
board work session, there's a lot of information. I watched it this
Right.
afternoon. Ms. Nolan's
Yes.
there, and it's a lot of good
Yeah.
information, a lot of good debate, and it's very educational.
Yeah.
You know, before, in '99, the commission voted to start offering this insurance.
Right.
Before that,
Right.
if you retired previous to 65, you just went out like you do in most of the private industry and bought your own insurance.
Right.
And the commission voted in '99 to do this, and at 50% of the actual cost. And I believe, quoting stuff I saw today on YouTube, it was the first year the total expenditure was $300,000.
It was
costing the county
just
$150.
for me. It was less than 150 if I remember. My
Well,
budget may
was-
have been 150, but
was the
it came
total.
in lower.
Please-
Yeah.
Please notice that the total county was
Yeah.
150.
Yeah.
Current year,
Mhm.
1.8 million, projected to be 2.2 million.
For the school board.
1.8
budget.
for the school board alone. Okay.
The school board alone.
Yeah. So that
For just that group?
for just that group.
And post-65s, both
Oh, that-
groups of
that includes
retirees.
post-
Yes.
Because the post-65 is people that get Medicare,
Right.
and they're just
Their rates dropped, and they have had good claim history. In this proposal, I believe they have a 10% increase.
There are trends all over, and Mayor Burgess may know of some of those trends, but there was a county in one of the northern states, and I want to say Pennsylvania, but it could have been Michigan or Minnesota, that is declaring bankruptcy because they can't pay their benefit bills for their employees retirement and medical. It's the biggest expense that they have, and they can no longer pay it. And the majority of people in that county that vote are county employees, it appears. So they're not willing to back off of those expenditures, so it's bankruptcy. And this is not an unusual trend to see happening in the private sector, and it's been happening for years. So the private sector just changes their benefits, lowers costs by changing benefits.
Well, and the private sector had this accounting, a similar accounting standard change back in the 1990s, which forced them to start reporting a cost for this future benefit. And guess what?
It
Said
actually
Commissioner's
goes to
right.
their profit and loss statement.
Right.
The
Mhm.
private
Yeah.
That's right.
sector.
That is the reason that
Oh.
the private business world stopped medical
Yes.
benefits,
Yes.
period, for retirees. They don't do it anymore.
Yeah.
There are only 2 or 3 counties in the state that offer retiree benefits, I mean, or a very
Well,
limited
and
number.
that is limited, but school systems have tended to be different because so many of the school systems, the teachers are in the state plan, which does still offer retiree benefits. And that was one of the things that helped lead to that decision back in 1999, because there was some discussion of the teachers wanting to look at the possibility of moving to the state plan because of that. But
Maybe equity between general fund employees compared to school
Right,
system
right.
employees.
Mhm. Yeah,
One
yeah.
having the ability to
Yes.
retire with insurance and
Yes.
a
Mhm.
sheriff's department
Yeah,
employee
yeah,
or something not being
yeah.
able to.
Mhm. Oh, yeah.
I believe the number I heard today was $11 million that needs to be booked this year alone.
This year alone.
Is that for the school system, or is that county?
I think that's for both.
That's for both.
But it's
Just to cover these
Yeah,
benefits,
yeah.
just
Mhm.
for this 1 year, $11 million needs to be put back.
Yeah.
Well, we're not putting
Yeah.
$11 million back,
Mhm.
just for this small piece of
Yeah.
issue right there.
Yeah.
The Gatsby numbers are absolutely
Yes.
phenomenal. I
Mhm.
mean,
Oh,
they're
yeah.
they're so big you just can't even comprehend them.
Well, and our initial evaluation from the actuarials, wasn't it a little over 200 million?
I don't know.
I
It
think
was-
it was,
yeah,
which was
$200
at that point more than, not the capital budget, but more than a year's of our entire operating budget of all the funds. I think it included capital or debt service, but the operating funds. And through that process, we got it down substantially. There are different benefits for different, based on service and when people were hired.
So we do have the latitude to alter our benefit package, hoping that will adjust the premiums. We do have that. I think that being
Well-
government versus private, because I know in my husband's company, that's what we had to do. We basically went to, we're self-insured for the first $5,000, where previously we had co-pays
Oh, yeah,
and
yes.
80/20.
Yes, there
Very
are things
limited,
that
though.
the commission, yeah.
It's very limited what can be done.
I mean, there's a drastic change. I mean,
Mhm.
for us, there was a drastic change,
Right.
and the
Mhm.
premiums didn't change.
No. Mhm. Oh, yeah. Mhm. Yeah, well, and one of the issues that we do have to keep in mind is that what we offer, under current state law, there's a requirement that our plan be comparable in what it offers to the state teachers' plan for our teachers. So that is something that when we make changes to our plan, we do go and have someone do a comparative analysis of the two plans.
And is that for active and retired? Is that true for both?
I don't know on retired, I just know on active.
Because I'm just thinking if there are counties that don't offer it,
Mhm. Yeah.
what do they do?
Most of the teachers across the state most of the systems are in the state teachers plan. There are the counties that have tended to go the self-insured route, as we have, tend to be some of the bigger counties. So it may not be a majority of teachers, but definitely a majority of systems are in the state plan. So.
Well, a great deal is going to happen on this in the next 30 days for sure, before we
Yes,
meet on
sir.
the 21st. I know the school board has as you said, discussing it tonight, and they're gonna discuss it again. The insurance committee, I believe, meets Thursday, 1 o'clock.
1 o'clock in the courtroom.
Right.
Yeah, they're all afternoon.
In the next room.
Yes, all afternoon.
I can see Will is really looking forward to that.
Yeah. Yes.
But at any rate, it would be wise for all of us, including the general public, I think, to keep up with this. And we need to remember too, as all of you are very well aware, we've got a lot of employees in the general fund. Mr. Sandvik's here, and he's representing the school system. But we've got a lot of employees in active pre-65 and
Yes.
post-65 that are in our general fund in this county as well. So, and then this applies to them as well.
Is there mandatory retirement age for the county, the employees, the school board?
I think that's illegal.
There's a normal age.
Yeah,
Yeah.
but I don't,
65, but
yeah.
there's no mandatory.
I don't think there's any mandatory.
I didn't think there was.
Yeah.
Thank you, Mr. Sandvik. We
You're
appreciate it
welcome,
very
Mr.
much. Very informative. Appreciate the paperwork as well, and well in advance too, so we can all study. Thank you. Committee, any new business? Discussions on that? If not, I feel adjournment approaching, and it may in fact be right here. We are adjourned. Thank you so much, committee.